The patient calls in to the call center, to the appointment desk, and we keep same-day appointments available. And if a same day is booked, the call center will message us and alert us that there is a patient that needs to be seen today.
With regards to triaging mental health crisis, it's a little tricky. However, it's based off of your experience with patients. And so it goes back to your medical training and what you feel comfortable with and what the patient tells you. So when it comes to a patient who is in immediate danger, the red flags will usually go off in your head. My goal is to keep the patient on the phone, on the video chat. And because I am able to sit in front of my computer, I have direct contact with one of our behavioral health counselor, which I can message right away and get her involved into the call. And that way, we don't hang up the phone with the patient.
So if we have a patient who's in crisis and a doctor is concerned about suicidal ideation, we will transfer that call from the primary care physician to an integrated behavioral health therapist. That person will make sure we know the location of the patient. Oftentimes they're at home, but sometimes people are in their cars and we need to know where they are, because if it's a true suicidal situation, we may need to call services to that person's location for help. A lot of times people feel desperate and they'll say things like, I don't know that I can go on, I just want to sleep for a long time, or I don't want to wake up. And it doesn't mean that they want to die or take their lives. It's a sign of how stressed they are and how desperate they feel, and they really don't see anything better for their life. So people come to us with a number of different life stressors. Some things have been going on in their lives for a long period of time. We see a lot of people who've had trauma from their childhood that they're dealing with now as adults. We also have people who, with the pandemic, are experiencing a lot of anxiety, a lot of job loss, changes in their situation. Maybe they're experiencing anxiety for the first time and they don't know what it is. So we're helping people with, again, tools for coping, learning how to deal with those situations. So telehealth has allowed us to have therapy sessions with patients that normally might not come into the clinic. We serve a rural community. Many of those people aren't able to get into one of our offices to talk with someone. And so we're able to reach out to them in their home, in their community, and they don't have to come into our office for services.
Our mental health patient, when they are in a crisis, usually before telehealth, they would have to find a ride and drive to our clinic for any kind of service. And now all they need to do is pick up their phone, get in contact with one of the physician or clinician, and we can establish care immediately.
Patients are appreciative of not having to come in and the flexibility that we're able to give them, that we're able to meet their needs without being right in front of them. It feels good to be able to help people in the midst of their crisis and be with them and help get their needs resolved and get them to a place where they're feeling better.